everyone, it's Janelle. Have you ever been to the emergency room and needed to wait in the waiting room for several hours before being seen? Were you wondering, what's going on back there? Am I not an important patient to be seen? Are they ignoring me? Have you or someone you've known ever had to wait in the emergency room for more than a day just to be admitted to the same hospital because of a no-bed status? Have you or someone you've known ever had to wait several days at one hospital just to be transferred to a different hospital because of a no-bed status? I've worked in a small community emergency room for the past 3 years, and I've seen these problems on a rise. This no-bed status they're talking about is not because they don't have any open beds. It's because they don't have enough nursing staff to staff the open beds. I'll give you an example. A 20-bed unit with 20 patient beds can only get 3 nurses to staff. Those 3 nurses can only take up to 5 patients. So that means that there's 15 beds full, and the other 5 beds have to stay open with no patients because there's not another nurse to staff them. These are all problems of the nursing shortage. So my question for you today is, have you ever been affected by the nursing shortage? The nursing shortage has been a struggle for the United States for the past several years because a lot of our nursing staff are beginning to reach that retirement age. And the baby boomers are just beginning to need all the medical attention. To put this into numbers for you, the United States would have to train 1 trillion nurses by the year 2022 to be able to fill all the vacancies and keep up with the demand. There are a few issues that stem from this that I'm going to share with you. The lack of nursing instructors, the lack of nursing slots, the competitive applicants. With nursing instructors, they can make more money in a hospital working on the floor than they can as an instructor. So this means that with the lack of nursing instructors, there's a lack of nursing student slots, which means highly qualified students are applying to these slots, which is making the nursing world more competitive. What are the fixes? The fixes are competitive wages for nursing instructors, an easier way to get into nursing school, and more experience for nursing students in the hospital world. So when they get out in the real world, they have already got some experience. So, as I said, a nursing instructor makes less than a nurse at a hospital. So this means we need competitive wages for our nursing instructors to get those nurses out of the hospital and teaching us nursing students. Nursing students need to have a better way of getting into nursing school. They've already started doing this with LPNs, medical military people. So LPNs and people with medical military background are able to start at a higher level than a freshman. For example, if you're an LPN at my community college associate degree school, you get to start at the 2nd year. So you get to skip the 1st year. Depending on your medical military background, you may be able to start at a different year as well. So this means that getting these people into the hospital earlier with experience is going to make taking care of our baby boomers a lot easier. So what are the outcomes? The outcomes from all this with the fixes would be more nursing instructors, which means more nursing students, which means baby boomers are going to be taken care of a lot sooner. Thanks for listening, and I hope you have a great day.